I think for many people, HIV is still considered a death sentence, but we now have very effective treatment, and people living with HIV can live very long and healthy lives. And so I always, try to understand from patients who are newly diagnosed what they know about HIV. And I try to emphasize that we have really safe medications, and that often, people living with HIV live, have very similar length of life or longevity as compared to people who don't have HIV. Meeting someone who has been through a similar experience can be also really helpful and empowering for patients.
People often have conflicting priorities. If somebody has to do their job or do their gig job in order to be able to pay the rent that month and not be on the street, they may very well prioritize that over coming in for their appointments. There is a percentage of people who just can't stay engaged in care, can't take their medication consistently. It's going to take a lot of resources and providing a lot more than we're typically thinking we're responsible for providing. So it might mean meeting people where they are rather than waiting for them to come into their appointment. Providing lots of case management and navigation and peer support.
One of the more effective methods that I've seen is really getting them connected very quickly. Being able to connect with somebody on the day that I give them their diagnosis is a huge asset. Waiting never helps.
So, texting to remind patients to take their medicines, reminders before appointments, helping patients to figure out, in their phones how to program reminders. I think also having disclosure is really important. So being able to share their diagnosis with people close to them, if that's something that's safe. We also help patients do that. And we know that disclosure can have a positive impact on engagement in care and treatment. Undetectable equals untransmittable is another approach. If someone has a partner who's HIV positive, ensuring that that partner if they're going to use undetectable equals untransmittable as their sole strategy, making sure that that partner is taking their medications daily and that they're maintaining a suppressed viral load.